So irritable bowel syndrome is a bit of a passion of mine. What is the irritable bowel syndrome? We all have our own definitions, but these are some of the facts. It's a medically unexplained illness affecting the bowels. The symptoms include bowel disturbance and abdominal discomfort and many other symptoms, often in different parts of the body. Fatigue is very common. Muscle pains are very common. The irritable bladder is very common. A backache is very common, etc. So it's an illness where the predominance of symptoms are in the gut, but there are also symptoms in other parts of the body. It's a common illness. It affects about 15% of people in the UK. It overlaps with other unexplained illnesses. So from what I've said, it will come as no surprise that it overlaps with chronic fatigue syndrome. There's about a 30% overlap. A same percentage overlap with fibromyalgia syndrome. A 60% overlap with chronic functional indigestion. A 50-60% overlap with depression, with anxiety. So this is a conglomerate of illnesses in a way. It just so happens that in our medicalized culture, we've chosen to label it irritable bowel syndrome, and it is a label. It has a strong association with life events and emotional distress. It has no distinctive pathology, but there are some physiological changes, but these are physiological changes of increased sensitivity and increased reactivity, in other words, motility. It's an active, irritable, sensitive bowel, if you like. There's no obvious cause, and there's no specific treatment. So what sort of disease is this? Is it, as many would have it, a disease awaiting a cause? Maybe. I don't think it's a disease. I think it's an ailment or an illness. Awaiting a cause? Well, many have tried, but we haven't found one yet. Is it a syndrome with several causes? And this is, again, an idea. There are a few distinct causes that people have been able to identify. But the vast majority of irritable bowel syndrome, we just don't know what the cause is at all. It is an illness invented by committee. I remember the committee that decided to label irritable bowel syndrome, the Rome Committee. And they started the ball rolling on this in 1990, and it's still rolling. And I don't think it's helped tremendously. Is it a malaise of the individual? Yes, it is. It's a very individual illness. If you get a lot of people with IBS in the same room, they all say, well, you've got IBS, but your symptoms are very different to mine. You've got diarrhea, I've got constipation, you've got backache. In other words, it's very much an individual illness with individual contexts and association. But I'm here to talk to you about, does IBS run in families, IBS and the family? Yes, it does. Yes, it does run in families, but maybe not for the reasons that we might immediately suspect. IBS is more common if another family member has IBS. IBS is more common if a parent has bowel cancer. IBS is more common in tense, unhappy families, maybe. IBS is more common if you have a family history of atopy. And it's more common in identical twins. So is this nature or is it nurture? There is no specific gene for irritable bowel syndrome. It's more common, as I've said, in monozygotic twins. There are some genetic changes, but they're small print stuff, really. There's an association with the hypermobility syndrome. People who are double-jointed, who have hypermobile joints, there is more likely that they have the sort of irritable bowel syndrome associated with constipation. It's still fairly small print stuff, but it's there, and the inference is that this is probably a genetic link. Or is it nurture? Is the family aggregation due to exposure to the same environment? There's also, of course, with nurture, there's also family stress, which is really important. I think the two important things, and I often tend to tell the students that, if you have a patient with irritable bowel syndrome, think food and mood. Think food and mood. Those are the two important triggers for irritable bowel syndrome. A number of foods that we know that can be associated with IBS. Fat, often forgotten these days. Fat, I think, is a really important one. It stimulates a gastrocolonic reflex. It can cause colonic spasms and irritability. A fatty meal is not good for people with irritable bowel. Fibre, particularly insoluble fibre, not good news. Wheat. Some people with IBS are sensitive to wheat. They may not have celiac disease, but there is a growing experience-based rather than evidence-based of gluten sensitivity. FODMAPs, we all know about fermentable sugars, at least the dietitians in the room know about fermentable sugars, and in fruits and vegetables, and know how these may be implicated in IBS associated with bloating. Hot spices, coffee, but also mood, emotion, changes in life, stress, the memory of what may have happened, the meaning of what may have happened, or foods. All of these things can affect the sensitive bowel. And the two interact. The way you feel can influence how foods affect you. So if you're upset, you're more likely to have more food intolerance. Food and mood work together. It's not either or. We need to think holistically. So gut reactions in childhood. A lot of gut reactions. We don't tend to diagnose irritable bowel syndrome in childhood, or at least we didn't. But I think irritable bowel syndrome, or what we call irritable bowel syndrome in adulthood, of course occurs in childhood as well. Why wouldn't it, in a way? And you wonder the associations with, for example, infantile colic. You wonder about what may be going on that may induce milk or egg allergy. You wonder about issues such as toddler diarrhea. A lot of my patients with constipation have potty difficulties in children. Food fads, very common in children. Abdominal pain. Again, abdominal pain of no obvious cause. People used to have their appendix removed because of suspected appendicitis. An awful lot of them were normal appendices. Constipation, eating disorder as you get older, exams, leaving home. So a lot of issues in children that may give rise to gut reactions. And there's pregnancy as well. There's data that indicates, it's not terribly good, but there's data that indicates that pregnancy may make constipation and bloating worse, and abdominal pain and diarrhea better. People with IBS also have a 20% higher incidence of miscarriage and may have problems conceiving. So there's an association there. What about IBS in middle age? Midlife crisis. Feelings of getting older, intimations of mortality. All the changes that take place. A number of my patients, as they get older, as the family have left home, empty nesting, looking after parents, it's quite a stressful time when you get up to your 50s. There's a lot of things going on, and that may well rekindle a sensitive and vulnerable gut. A lot of people, as they get older, have weight and diet problems. Everything, if only they could actually lose weight, they would feel so much better. And IBS in old age. What's going on in old age? It's this patient here. Since I lost her, I rarely get the feeling I want to go. So loneliness is an issue, illness, despair, and not able to look after yourself terribly well, an inadequate diet. So these are some of the issues. These are some of the areas that we spend our time dealing with in the charity, in the IBS network. And one of the things that we are placing a lot of emphasis on in the network at the moment, we want to create a comprehensive self-care plan that allows people to have some resource to look after themselves. But if they have that resource, what we want, they still need contact with people. At the moment, the GP is really too busy, I think, to look after people with IBS. What we need to do is to recruit people like yourselves who are healthcare professionals who you may have more time to understand and listen and help people with irritable bowel syndrome. Thank you for your attention.